Okay, so it is 4 p.m. on the 15th. This is the Advisory Board of Health Q3 meeting. I had sent around some minutes for our Q2 meeting. Any changes?
I had it pointed out to me that the date might be wrong, that it was actually June 16th rather than June 17th.
Okay. So we will make that change. Other than I'm just looking at my calendar here, David, and
that also needs to be reflected in today's agenda.
Okay. Other than the date change, any other changes? Can I get a motion to accept the minutes with the date change?
Yeah, we accept.
Great. Okay. So Mac moves. Everybody accepts. Okay. First item on the agenda is ABH update. David.
Okay. So first I'd like to talk about our staff, and the reason that I noticed that the date is wrong is because our admin Michelle is back. And boy, you know how important she is for us to function on a regular basis, let alone under the circumstances we're trying to operate in now with all this COVID distraction. And actually, it's more than a distraction. It's almost it is a full-time position, and that is a discussion that I'm going to have to look at much further with staffing, because with the demands on the position, my position, and others, the COVID thing is just a whole level of work that we just don't have the staff for currently. And there's grant money available, and there's COVID money. So I'm going to see what I can cobble together, because I really think we need to have a full-time nurse here. You know, someone who could do full-time contact tracing. You know, there's, with all the activity starting in schools and sports, I'm sure there's going to be a huge demand on our time. There is now, you know, both with just answering phones, answering questions, interpreting constantly shifting state requirements, and applying them in the field is just incredibly difficult. We did have a part-time nurse doing contact tracing. She took a position full-time with the school. So we're back to our part-time 10-hour-a-week nurse, Paula, who's trying to do contact tracing too. And that's just simply not enough. So we do have some work to do with that. Other staff update, we added a part-time sanitarian, very highly qualified sanitarian who worked here 15 years ago in Darien for a while. And she's going to be helping do our food service. She can help with septic work, and she can also help with the cosmetology salon. So that's going to be great help, but she's also only 10 hours a week. But we need all the help we can get in these circumstances. The demand on our time is just incredible. And so Mindy, I'm pleased to report, has started her MPH program. So she's going to work on getting her master's in public health. And I think that's great for her, and it'd be great for us here. So that's it for the staff update. As I said, you know, we're trying to stay ahead, and we're doing our best. Flu clinics, regular flu clinic, we think it's important that we offer a flu vaccine this year, although we don't want to do an open clinic. We don't want people walking in. Town hall's not even open yet. So what we're going to be doing is flu shots by appointment. Our first set of flu shots will be Thursday to just town hall employees. Those are within the building. We've also arranged with Public Works and Parks Department to do another sort of appointment flu shots at the town garage, and that will be next Thursday, the 24th. After that, we're going to be doing offering by appointment flu shots here at Town Hall in the gymnasium, and we're going to socially distance and set up walkways so people won't be in each other's way as they come and go, but it's going to be by appointment. And we'll have 3 nurses to do shots. So we'll see how that works. We thought about doing drive-throughs, but the logistics of that are just a little challenging. And we haven't done it before. And I don't want to put ourselves outside and not know what the weather's going to be. And the challenges are going to be daunting enough indoors without trying to work around people's cars and give shots outside through car windows. So we're going to stay old-fashioned in that regard. I know there are other jurisdictions that are offering drive-through flu shots, but we're not going to do that. But the final public schedule will be made available by Thursday. We'll have it posted on the website and we'll put it out to the media. So we're going to focus on town employees first by appointment, make sure that the scheduling program works well, and then we'll open it up to the public in October. And at least one by appointment, 1 day a week by appointment. We're getting calls. There's demand this year. People are concerned. We booked our town hall flu shots within an hour and a half of announcing that we were going to be offering flu shots. So we'll be adding another, at least 1 day to that.
David, is there, I've been hearing some rumblings about a flu shot shortage, seasonal flu shot shortage. Are you finding it difficult to get or availability for a vaccine?
I believe we have our full shipment.
Great.
Yeah, I don't, you know, we got what we ordered, so we're good to go. We have our full regimen, what we ordered. Now, I don't know, you know, if there's a demand that exceeds our supply, you know, I don't know if we'll get more. I don't know what the status will be. I do know that there are some doctors that aren't getting their vaccines until sometime in October. So, but we already have ours.
Great.
Any other questions about flu clinics, flu shots?
No, all set.
Okay, COVID update. There's a lot to talk about here. I circulated today's weekly summary. I don't know if anybody had a chance to look at it yet, but the weekly summary is very interesting because it really tells the story of what's happened here in town, and it pretty much mirrors what's happened in Connecticut. And that is, we had a lot going back in March and early part of April, and since then it's been a smatter here and there, and it continues to be that way. So we have the weekly summary, positive tests by test date, monthly, we broke it down, and then we did monthly. And of course, our biggest month was March, and then down April. We had a spike in July. Couple reasons, I suppose, for that. One of that was a family of 5. So, you know, so you had everybody got tested, and it was positive. The testing, and we have a chart that is COVID tests by month that includes all negatives. And if you look at that chart, I don't know if you have it up, but back in March, when this all started, people getting tested were primarily already sick, and they were getting tested and getting confirmed. So our positive rate for testing was over 50%. But since that time, as testing has become more available, and you could see that in the chart, March there were 204 tests. By the time August rolled around, there were over 1,500 tests. People got tested here in town. and 14 were positive for the rate of under 1%. So, the testing has gone up. We offer the testing, as you know, at the Leroy parking lot, and it's been, we haven't had any positives at our clinic since July, and there have been over 500 tests done just there. So we're not seeing a lot of positive activity, positive cases in town. The one thing that we have seen that is important going forward is to note that there are more positive cases occurring in younger people, 20 and under in particular. So as of July, we broke out the chart by age distribution a little bit more than we had before. And we also broke down the charts to show cases by age, starting from March through July, and then from July to now. We took them apart because the age distribution is very different from the beginning to what it's become. I think that tells the story of where we're going with this. With respect to the serious nature of this illness, we've had 16 total hospitalizations, none since May. And that is confirmed because that's data. That's not just something that wouldn't be referred to us that we wouldn't know about. So there's been 16 total, 4 in March, 9 in April, 3 in May. There are a total of 5 deaths in town. Sad to say, the last death was in April. So, we move forward with planning and opening facilities and kind of trying to move ahead with society based on the numbers, as the governor said, and our numbers look really, really good. That's part of the reason why we're obviously opening schools, is because right now the data is showing that we're not having active community transmission. There's some undercurrent, and there has been some illness associated with contacts of people coming in contact with those who are from states that have elevated COVID levels, in quarantine requirements that the governor has established, which as of yesterday, the quarantine requirement has changed. You can now test out of quarantine if you're coming from one of those states. In Connecticut, the details for that haven't been announced, but that was just a change that the governor announced yesterday. The other change the governor announced yesterday was the fines for failure to wear a mask. There's different types of fines associated with different types of activities. If you don't wear a mask, simply don't wear a mask, there's one amount of money. And then if you have an event, the organizer of the event, if they exceed the guidelines of the state, is fined a certain amount of money. And then if you go to that event and you're part of that group, you could be fined as well. The fining agencies as defined by the governor are local health, the police department, or chief officer, which none of us are quite sure how that's going to work, and the details for fines have not been established by the governor as yet. And that's not something that I really want to, or feel that, we certainly have never gotten involved in fining before. As an agency, we do have late fees for permits. We have reinspection fees, but we've never gotten into the realm of enforcement fining. So the details of that really are going to be interesting to see how they're going to play out. So that's something that Jamie and I have had some preliminary discussions about. We'll see how that plays out. sports and sports activities, it's been a big issue, and there's a lot of inconsistency on the part of the state. The state health department in particular has said one set of standards for schools and CIAC and another set of standards for independent leagues. We've been trying, as my colleagues and I have been trying to get some consistency and some guidance in what we're supposed to say based on the questions of logic and say, well, if it's not good for them, why is it good for these kids? And the issue of who's running the show with respect to, is it science or some other concept, is kind of a little foggy at the moment. COVID vaccination planning, that's a whole nother activity that we have to think about going forward. We're not sure about the vaccine. I'm sure you've heard on the news, there's been some questions about whether the vaccine is being rushed, if it's going to be tested well enough, how safe it's going to be. These are all issues that will be worked out, I hope, soon. We'll see how that works. We're looking at regional planning for the COVID vaccine. Currently, it looks like it may be a 2-dose regimen where, depending on whose vaccine gets approved when, it's either 21 days between 2 shots or 28 days between the 2 shots. And I'm not sure how we would manage that. Certainly, we couldn't with the staff we have. So that's another reason to think about, taking a good hard look at how we're going to manage and how we're going to plan and how we're going to react to this in the long run. And with contact tracing, that is tremendously involved. It's a 24 hours, but it's a 7-day-a-week responsibility because the reports come in 7 days a week. And the key of being an effective contact tracer is to get onto a case quickly so that that person, once they're determined to have been positive, can be isolated from the population, and those people that that person was in contact with can also be contacted so that they can be isolated as well. So this is a demand, and it's a staffing demand that is going to be challenging at best, especially if we have a resurgence in cases. So the vaccination planning is in the very advanced stages. We don't know how it's going to be distributed, and we'll see. PPE, we distributed a lot of personal protective equipment to our local healthcare providers. We still have some that we stockpiled here, again, anticipating that we may get a rebound this fall. So with that, I'm not sure that I'm sure I have more that I could say about it, but I'll take questions.
David, I assume you're leveraging the kind of distribution plan that you have existing in the town's health emergency plan for distribution of vaccines, just as we would if there was distribution of anything else, correct?
Yes. The thing is, I think I mentioned this to the board at our last meeting, was the way the state distributed the PPE was not done in accordance with planning in the preparations, utilizing the whole system of distribution that we'd spent several years working on. It totally went out the window. We did it a different way. So again, you do all the planning, and then when things happen, it doesn't always happen the way you plan. To answer your question, at this point, we do hope that it would be in accordance with what we have been working on for the past several years. Yes.
Okay. Fair enough. Thanks. Was there any indication as to why they changed that model, like in the middle of the game?
Yeah, because the supplies weren't distributed by DPH. It was distributed by the emergency preparedness group. There's a different organization that distributed. So they didn't want to, they just said, well, we'll go to Rhode Island, Westport. That's easier for us.
Okay.
That's just
Yeah.
the way it happened.
No, I get it. Okay. Thanks.
You're welcome. Any other questions on COVID or where we are? Okay, well, hearing none, we'll move on to the rest of the world and what we do. And everything that we've done, everything that we do, and all our responsibilities have had this element of COVID added to it. So when we inspect food service facilities, we now have to check for the spaces, we check for the different, are they using the right menus, disposable menus? Are they sanitizing in between use? Do they have the appropriate signage up? There's a whole level of additional responsibilities in part of inspections that we have to do now that adds a considerable amount of time, because there's also a lot of questions that people have in the facilities to our staff who are doing the inspection. So, you know, there's a lot more time, which is one of the reasons why we felt it was so important to add another person to actually go out and help. The other reason we did that was because our other part-time person got a full-time job elsewhere, and his hours became more limited. So we just needed to have that person kind of replaced and supplemented, is what this is. So we're back to our full service inspections with the ratings. Our Darianite comes in, gets the reports once a week, and is back to publishing those summaries on his website. We're back to posting them online. So that part is back to normal. So the no word on the FDA food code adoption, that's still in limbo. So that's my report on food. Any questions, comments, thoughts? We did have a few places that closed down during, you know, that actually went out of business. The most recent casualty is Taco Bell on the highway, closed both of their operations. Well, we've had new places come in, and we have interest for new facilities. So you'll see some newer places opening up soon as well. So that's the good news.
David, what is your take on the outdoor dining versus inside dining? Are local restaurants abiding by the current rules? Is it working?
Based on the reporting I'm getting from our staff, it is. And I have personally walked through town and gone to verify the way the tents, tables and chairs are set up. And generally speaking, other than a few comments here and there, they're doing really well. And, you know, I want to commend residents as well, you know, with mask wearing. And to back up a little bit, I need to mention the fact that I walked through the schools today with Dr. Adley. And, you know, that's been a significant component of the COVID response, is working with the schools and with the Board of Ed and with the Director of Nursing and their medical director, Dr. Kenefek. Walking through the schools today, talking to the principals and observing students and how they have things set up, very impressed. They're saying they're getting very, very good compliance with the masking with the children, with the kids, even in high school, which is really great to hear. We have another week or two, week and a half before we go to full-time. Right now we're doing hybrid. So it's half the students are there. And, you know, I think this was a really good plan and a good way to open, because it gave us a chance to kind of identify some of the bugs and make some adjustments. And we're still looking at how we're going to achieve safe lunches. And, you know, with all the kids having lunch, say, and maintain distancing safely. It's not so bad now because it's good weather still, but these are all things we're going to have to kind of work out as we go along. But anyway, I just wanted to report that we did walk through the schools today. We are focusing on the school lunch program as well, ensuring that how the food is actually being delivered. If they're having lunches in multiple locations that can't all fit in the cafeterias. That's been a big role that we've been working with.
That's great. Thank you.
You're welcome. There's been, and I think that there's been some reports of this in the news, there's been a sort of a renewed interest in real estate in Connecticut by New York City residents. And I'm not sure if that's what's causing this, but we have been really busy with people doing title searches and requests for septic system inspection and information and rebuilding of septic systems. So we're busier with septic now than we've been in a long time. So there's been sort of a, I don't know if you're going to call it a sort of a financial boost that's occurring to some degree, but there's certainly interest in real estate in town, and actually in lower in Connecticut. So we've been busy with that. The other thing that we've been busy with is we submitted more rabies bats for rabies testing in the last 2 months than I think we've ever submitted in the course of a year. Twice in August, we sent 2 bats in one day. Never did we have anything like that. And I don't know what to attribute that to, but the good news is that they're all been negative. So we're not seeing rabies, but bats are getting into homes. So, but we're still offering that. We still are offering testing for ticks. The thing is now people can mail the ticks directly to the ag station for testing. They don't have to bring them in. So we've figured out how to work pretty well remotely, and have a lot of our forms and applications online. We are still not able to take online payment, however, and I priced it with our software company that does our digital health, and it's very pricey to integrate it into our software system. So I'm not sure where we're going to go with that, because that would be very helpful for permit renewal if we could have online payment, which we don't. But anyway, the ticks are being submitted directly. It's not been a really tough tick year. It was not as bad as last year, but they're out there, and the ag station's reporting a new invasive species of ticks they're finding in naturally lower Fairfield County that carries more disease and illness with it. So we'll see how that plays out. We have had positive West Nile virus mosquitoes found here in town. So we put out our advisory to residents to cover their skin, wear repellent, try to minimize your dawn and dusk outdoor time. Make sure there's no standing water around, empty those barrels, buckets, and gutters, and just try to minimize the stagnant water. But West Nile's here to stay. Any questions about those vector things, rabies, ticks, mosquitoes, and whatnot? Okay. This is also the time I mentioned about online permit renewals, where we're renewing our salon and cosmetology salon permits. Again, that entails another level of work to ensure COVID measures are being taken. And that's like eye shields and face masks for people working, separation of stalls and pedicure bins. It's another time-consuming additional responsibility that our staff has in order to do their jobs, and it is significant. And again, doing the inspections, we spend a lot of time going over issues and answering questions to staff and to owners and managers of facilities. It's a challenge. Beach water sampling. We can report that this year was a good year for beach water bacteriologically. There was a period of time where sea lice were found, and sea lice kind of get stuck in a bathing suit and they sting, and it's like tiny jellyfish, and they sting and leave welts. But my understanding is that that was a kind of a passing thing. So we had to, we kind of had the lifeguards post a notice to beach goers to be aware of that. But bacteriologically, that was not a problem. We did manage to get, not all the pools even opened in town. We inspect public pools, that's condominiums and clubs and so on. Not all the condos opened their pools this year because of potential what they feared liability issues. So I think 2 of them didn't open. But we did inspect and managed to inspect all the other facilities, and they did a fine job. And they do a fine job with the pools here in town. I don't know if you noticed, I'm going to keep moving on, that there's a recent report of a new disease causing illness in Long Island Sound, Vibrio. 5 cases, 5 people were hospitalized with Vibrio. Vibrio is actually, they call it pretty rare. And I saw at least in one newspaper article that was referred to as flesh-eating bacteria. It is not. It's a different kind of an infection. And Vibrio affects people who go into the water with a wound. They've already got a cut, they have an abrasion, and there's a break in the skin. And if there's Vibrio in the water and they get near where you are and you have that break in the skin, you could catch it. But the 5 cases were all people who were in Long Island Sound this summer. It's not a lot, but it's still something that that causes concern, because I think that it's considered to be one of those indicators of climate change, because Vibrio tends to be in warmer waters. So I don't know, this may be again a trend for the future. Speaking of climate, there's the issue of drought. We're in somewhat of a drought situation again, not as bad as it was a couple of years ago, but we're looking at, Aquarion's looking at the possibility of issuing a decree restricting watering to 1 day a week, irrigation watering at once to 1 day a week, and requesting further conservation measures be taken. And we'll be looking at that. We have weekly updates and every other week updates with Aquarion, where they report on the reservoir water levels and water usages in the community. So I want to stress to people that really it's time to be careful. Unless we get a sustained period of rain, and there's none in the forecast, we're liable to hit the next drought trigger and have further water restrictions come our way. We've already kind of advised against a couple of, here we are, great deliverers of good news in public health. Some fundraising car washes that we've kind of said, it's sending the wrong message. We think people, to get cars washed, should go to a recyclable car wash area itself, or just to really try to be careful with your water usage. Shellfishing permits, we've also, maybe it's because people were home. During the summer, we gave out more shellfishing permits in the summer than we had in the same period last year. Again, you know, that's another one of those items that would be helpful for us if we could have some, the ability to accept online payments and do things more remotely, because that is a pretty much a person-to-person interaction. Then finally, emergency planning. Well, that's what all this COVID is about. And we are testing plans. We're looking at our pods. We're looking at and reinforcing our communication networks, both internally and externally and regionally. So this is the real thing. I mean, you know, we talk about emergency planning. We talk about pandemic. This is a pandemic. This is an emergency, a public health emergency. It's been declared as such. So we're in it. You know, we've been talking about it for years. This is it. It's here. And, you know, so we're doing our darndest to protect the community we serve. And with that, again, I'll take any of your questions. That's really pretty much it for my report.
So David, related to the Vibrio, those 5 cases in Connecticut, do you know where they were?
They were only identified by county, so it was a long stretch. 2 in Fairfield, 2 or 3 in Fairfield County, New Haven, and the one out further east. They didn't.
London.
They did not say what town. However, they were in Darien. It is a reportable disease, so I would know, and I would report that to you. So it was not in Darien.
Okay, thank you.
You're welcome. Thank you for asking that. Worth clarifying. That's my report, folks.
Okay, thank you.
David, thank you. I gotta say, just on behalf of the board, I want to thank you for your thoughtful leadership during what's been an amazing and unique time, not only leading through COVID, but continuing the good work that you do in your daily activities and responsibilities. I am personally grateful for all your hard work and that of your staff, and I would imagine I speak for the rest of the board. So thank you very much for your work and your report.
Thank you, Kevin, and thank you all. I appreciate your support. And
Thank you.
I will pass that along to staff as well. Thank you.
Please do. Unless there's anything else, gang, our next meeting is scheduled for Tuesday, December 15th at 5 p.m. I think we'll have to kind of wait and call an audible sometime in December about whether we'll be allowed to meet in person or we'll continue these virtual meetings. But we'll reach out well before that to let you all know. But Tuesday, December 15th, 5 p.m.
Well, I, just as a comment, this meeting came by really fast after the June meeting. Like, oh my God, you know, time is just, it's incredible right now. And, you know, I'm sure this whole scenario has changed everything. The relationship, time availability is just not like it used to be.
You get it. We get it.
Kevin, thank you so much, and everybody stay well.
Cheers, everybody.
Thank you.
Thanks.
Thank you.
Bye now.